Hi. I took a break during lunch today and got out and enjoyed some of that sunshine, and thought I would share a video with you today about walking. So yesterday I decided to set a goal to start losing some weight, get in shape, getting stronger, and I took a 2-hour walk. So I had to stop at the Carmel High School football stadium and lay on that grassy hill and just stretch out, because as I was walking, my whole body was just kind of hunching over. I have not done any exercising this winter, so my muscles were not ready for what I had them do yesterday. So, backstory, a couple years ago, I was bent over lifting my dog out of a chair, and I felt my sacrum, which is that triangular bone in between your hips, I felt each side just go rip, and I was on the floor. It was not good. So what I ended up doing was really spraining my ligaments really bad, and since then my sacrum has now shifted backwards. So now when I use that joint, my body will shift forward. So today what I did, yesterday when I walked, I had a pair of orthotics in, so I have these in my shoes. I got these when I was out in California. They have a nice lateral arch to them. And once I put these on the very first time, I felt my hip joints just line up inside my sockets, so it was great. I posted a link to Amazon on this page for some sandals that provide kind of the same support that was recommended to me by the guy that gave me these. So, so what I did today, because I had my orthotics in, but my muscles in the front were really tight, I grabbed my handy dandy, let's see if I can pull it up here, SI belt. So some of my pregnant moms might recognize this. This belt helps hold your, you call it the SI joints, the joints that are on each side of your sacrum. They compress it and hold it together. So when you're walking, instead of the bone moving so much, it stabilizes it so the bone doesn't move so much. So how you can tell if you might need to walk with one of these SI belts initially until you get stronger is if you put your hands on your hips, and then like on the top of your hips, and then come down a couple inches and maybe over. Dig into that muscle right there. If it's tender or if it feels good when you push in there or you feel a knot, chances are you have a SI joint that might be a little too movable. And also, if you've been on my table and you tell me it hurts on the right, and I tell you you're locked up on the left, chances are you have a joint that's too movable. So you might need to walk with one of these. So if you want to get out and start walking and be comfortable, you can grab one of these. If you look at the pinned post on the page to Full Script above, they do sell these online through Full Script, and it's actually cheaper than what you can buy them in our office for. You can get them there, but just wear them, to get yourself started. And then once your muscles start getting stronger, then you don't need it anymore. But, get out there and enjoy this beautiful day. And I look forward to seeing you soon.